Good morning, everyone. Welcome. We are really happy to have you here with us today as we launch into another webinar really focused on the protocols that we released last Friday. Hopefully you've had a chance to take a look at them. The main purpose for this meeting today is just to go back over them in a little bit more detail together, just to explain and voice over some of the key differences between last year and this year, and really just to hopefully answer your questions and help you feel as confident and strong and ready for the start of the new school year as at all possible, because I'm really excited about our students coming back, really grateful for the work that you're putting into that. And we just want to be here today to help you with that process, help you feel just knowledgeable and confident and ready to welcome the amazing students who we have the privilege to serve. So let me just go right along. I'm not going to go into presentation mode because I'm going to show the protocols with you in just a second. But just always a reminder, this is a little bit of an amalgam, today's presentation, focusing a little bit more on protocols, a little less on testing, but it's still very relevant to make sure that you know that our testing team is listed here on this page, the primary people. There are a lot more people who help us out as well, don't get me wrong, but a lot of the people who you might be interfacing with, or who our vendor CIC is interfacing with a lot, are listed on this slide. And as always, I hope that you will feel free to reach out to any of us with any questions that you have. And I'm always grateful for the support that the Shaw Foundation is providing with that kind of on the ground know-how, sharing what really effective practices are across districts. You're not alone in this, and there are a lot of people who are ready to help. With that in mind, just want to show you what we'll be talking about today. So just starting with, we want to go back over the protocols that we released on Friday. Think a little bit more about the testing program that we also launched last week, and just begin to answer some of the questions that came in from you, and then think about next steps and leave plenty of time for Q&A today. So just to get started, as I mentioned, we released our protocols document last Friday, and we included a link in the presentation for you. I'm going to tab over right now so we can take a look at that document. And what I've done, instead of creating a whole slide deck on this protocols document, I've just gone through and kind of highlighted the really important points that I want to call out to you. I hope that by doing so, when you go back to it, you can maybe more immediately find the information that you're looking for. I know that when I was a superintendent, it's sort of easy at times to get a little overwhelmed and to think I knew what the answer was, but always going back to the document to make sure that you know what the recommendation is that we're putting out to you. Because I imagine there'll be some competing ideas about what's the best step to take. And a lot of these things are going to be coming at you and your teams fast and furiously. And so we just want to make sure that we kind of just calmly review what's in this document today so that we can be ready. So I don't have a lot. There's some important stuff up here at the beginning about the background. I just want to remind you and actually show you this part that I highlighted first, that the beginning section of this document includes a lot of the links that you need around getting started with testing. I wanted to call out this important bullet, this important paragraph that includes the online form for setting up a vaccination clinic. We just know how important the vaccine is to being ready for the new school year and being successful during the school year. And so just please take advantage of that on-site vaccine clinic that we can set up for you. I'll say a little bit more about that at the end, but my main point about the beginning section here is just to keep in mind the important points. And I don't even need to highlight this because I know that so many of you know this and use this, but our Rapid Response Help Center, particularly Anne-Marie Stronach, is so ready to help. And sometimes I know that just even if I think I know the answer, just calling and getting that confirmation can be reassuring. And Anne-Marie and anyone else who helps the Help Center this year will be glad to do so. So no question is too small. Keep them coming. That's what we're here to do to help. So let's go into the document a little bit further and just start with our definitions. And this is a really important point. I think one of the biggest changes for this school year is what we see under the COVID symptoms definitions. This is what I really want to make sure that you are really honed in on and noticing these differences. Again, we didn't have vaccinated individuals quite as much last year as we do this year, thankfully. And so let's just start here at the top. So unvaccinated individuals and any close contacts need to follow the testing and quarantine protocols outlined in Section 2. We'll get to that in a minute. But here's the big difference. Vaccinated individuals who are not close contacts should follow the testing and quarantine protocols if they are experiencing the symptoms in bold. So if an individual is vaccinated and they're showing symptoms, these key symptoms that are in bold down here, that's where we really want to take notice of those vaccinated individuals, and they need to make sure that they follow the testing and quarantine response protocols. So let's just take a look at the symptoms list, because this is different than last year. And so, please don't rest on the information you had last year about the symptoms list. There are some key changes here. So if you will, the kind of primary COVID symptoms, or the kind of standalone COVID symptoms, if you will, are these first ones that are bolded: fever, difficulty breathing, new loss of taste or smell, muscle aches, body aches. And then I included cough as well, because it is a primary COVID symptom, but it's important to note that there can be other causes of a cough. Some individuals have a chronic cough, and so it's not always the indicator that these others are, but it is a key indicator. And so, keeping in mind that these are the kind of the standalone COVID symptoms, what's really changed for this year, and that I really want to make sure you're looking at closely, is these additional symptoms that are only relevant for COVID when they're in combination with other symptoms. So particularly sore throat, for example, is a change that it's when in combination with other symptoms. That was not the case last year. So again, we just want to update our knowledge, make sure our teams know this information, your school health professionals, your principals, whoever's relevant to needing to know this information, just please make sure that they see this difference in the symptoms list. And then, the actions that you take as a result, because, there are different actions that you take. The symptoms really kind of spur the response to the scenario. And so just knowing this updated symptoms list is important. This might be something you want to cut out and paste and post up on a wall, just so that people really get this, these key symptoms down and understand the difference. So I hope you find that helpful. And, like I said earlier, we're going to save lots of time for Q&A at the end. So if you have any questions about this, please don't hesitate to ask. The next really important thing is about our close contacts. And so I always want to remind us that, our definition of close contact, the definition has not substantially changed. What has changed is the response. And so over time, when we think about where we started last year to where we are now, the response in the way of a requirement for quarantining, for example, has changed, and, test and stay is going to allow us to change even further. But that definition of a close contact being defined as an individual who's been within 6 feet of a COVID positive individual while indoors for at least 15 minutes during a 24-hour period, that's still the same. So a close contact is still considered a close contact. But again, what's different is the response. So there are certain close contacts who are exempt from any quarantine response protocols. Those include asymptomatic, fully vaccinated individuals. So our students who are 12 and up, our staff members, any of those who are vaccinated and are asymptomatic, really important to have both, right? Symptomatic, we would take a different response. Asymptomatic, fully vaccinated,
Russell, you okay?
All right, I switched back to computer. How does this sound, Lauren? Is that all right?
Yep, great.
What happened?
We have you back.
All right. Where I am right now, the internet connection isn't great, and so that's why I tried to call on it first. So if it does get the least bit fuzzy, just let me know.
Sure thing.
Thanks for your patience, everyone. All right, so we were talking about close contacts who are exempt from the protocols. We talked about the asymptomatic, fully vaccinated individuals. Classroom close contacts, if they are spaced at least 3 feet apart. So anyone who's exposed in the classroom while both individuals were masked, and as long as they're 3 feet apart, they're exempt. Remember, that's how we ended last school year, so that should be pretty familiar. Bus close contacts are do not have to quarantine, and anyone who's had COVID-19 within the past 90 days and is determined to be a close contact also does not need to quarantine. So again, I hope that's helpful. Just remembering, there are a few key categories of individuals there. and just being ready to respond according to how they might fall within those responses to close contacts. Let's now talk about the testing and quarantine response protocols, really starting with the quarantining protocols. And so just beginning with, to orient you to this document, unless, in case you haven't gotten well familiar with it yet, we have protocols that are listed by alphabet or alphabetically. And so protocol A is for individuals who test positive for COVID-19. Now, I think we're pretty aware of what to do when individuals test positive for COVID-19. So I hope as I'm going over this with you, say, this is confirming, this is reassuring me that a lot of what I did last year remains in effect this year for anyone who tests positive for COVID-19. So again, important to note that, we are looking at a duration of 10 days after symptom onset or after a positive PCR or antigen test if asymptomatic. And what I really think is key about this, that I really remind myself of a lot, is that this is not based so much on time as it is on, it is based on time and symptom resolution. So we want to see that, there's an improvement in the symptoms. We want to see that we've gone those 10 days. And we don't need to have repeated testing prior to coming back. We just need to make sure that we do it, doing it once, right? Having this, if you are to be tested, if you are to choose to go with testing, we don't need to do it repeatedly. Once would suffice, as long as it's showing that you are experiencing that improvement and you've waited the 10 days. So let's move on, because again, I think that one is pretty familiar. Let's talk about our B protocol for asymptomatic close contacts. And we've broken this into a few different subcategories that are important to hone in on here. And, we can come back to this with some key information here about test and stay, and some important information just to review at the beginning, but I wanted to show you the difference in our B protocols, starting with B1, which really goes into test and stay. And I really appreciate the interest that you've already shown us. We have lots of districts signing up, schools and districts signing up for our statewide testing program. And we're really excited to get started with you at the beginning of the school year. And so if you're involved in test and stay and a parent has consented to it, a close contact can remain in school and does not have to quarantine as long as they meet these conditions. They have to be asymptomatic. They have to wear masks. So keep in mind, you might have a school, maybe it's older grades where your students are not wearing masks at all times, except for when eating and drinking. If they're not, and they're identified as close contacts and you're doing test and stay, they do need to wear masks. And if they can't be masked, then they need to be maintaining that 3 feet of distance. We're recommending that they maintain that 3 feet of distance from other individuals to the extent feasible. So then we want to see those individuals taking our rapid antigen test, most likely by next now, each day. And they, again, remain in school as long as they're getting that negative result each day that they take that rapid test. And then we know that this will often fall over a weekend. And so if it does, we want to make sure that that the person who is doing test and stay takes a test the day that they return to school. So let's just imagine it's a 2-day weekend, and that's part of the 7 days. When they return on Monday, we want to make sure that they get that test and continue on to stay in school, and if they're negative, and keep learning, which would be really what we're trying to do here. And then if we want that individual to continue to monitor for symptoms and make sure that they're watching to see how they're doing over the course of an entire 14 days. But after the 7 days, we can stop the testing. Just going back though, I want to make sure that you see that it is our recommendation that individuals quarantine on weekends. We think that's important too, if they are part of our test and stay program. So again, we'll be glad to answer questions at the end. So I see a hand up, but we'll pause for questions at the very end. So Derek, hold on, we'll get to you. And we will just make sure that we maybe cover all of this and then come back to you with questions that we can answer at the end. So looking then at protocol B2, this is our traditional protocol. So again, I hope this is kind of hitting that part of your brain that says, I'm familiar with this. I know what to do because we went through a lot of this last year. So this is if you're not doing our test and stay program, or if either the family hasn't consented or the school doesn't have the test and stay program, then we do need to see individuals quarantine from the quarantine has to last at least 7 days. And we need to, to cut down on that length of time to make it just 7 days requires a test, a COVID test, either PCR or rapid antigen on day 5 or later, right? So if you take it day 5, you still have to stay out for the 7 days, but day 5 or later, you can get the test and receive a negative result. And then you are able to come back on day 8. And we had a lot of questions about this last year. Which day do you return? It is day 8. And so just needing to get that test and then hopefully seeing that negative result and being able to return on day 8. Now, let's just say that imagining that a family or an individual doesn't receive the test, doesn't get a test, doesn't get a COVID test, then the quarantine, just like last year, lasts for 10 days from the date of exposure, and the return date in that case is on day 11. So again, I hope that helps to know that this difference between if you do receive a test or if you don't, what the length of the quarantine is. And again, this is not a huge change from last year. So I hope that, this is building on what's familiar and adding in some new things as well. I do see the raised hands, and like I said, we'll make sure we answer questions at the end. So feel free to put them in the chat, and we'll make sure that we moderate and answer your questions as best as we can at the very end of the presentation today. So let's talk about what the protocol is for symptomatic individuals, particularly what we call Protocol C, and how we respond to symptomatic individuals. So this protocol, I really want you to keep in mind, applies to both vaccinated and unvaccinated individuals. If anyone is showing symptoms, and remember, go back up to that symptoms list and make sure that you're well familiar with it. It'll help you just to know what we need to do if we have someone who's showing those COVID symptoms. And we have kind of a recommended approach and an alternative approach. So our recommended approach is really making sure that we're seeing that symptom resolution, and the individual has a negative PCR test, and they are not a close contact. They can return to school if the so again, they can have a test, or if a medical professional makes an alternative diagnosis for the COVID-like symptoms and their symptom improvement. Really important. If they have that symptom improvement, been without a fever for 24 hours, without fever reducing medications, then they can return. But keep in mind, this is, there's sort of a Venn diagram of situations here of kind of overlapping scenarios that could, kind of touch upon each other. And so if we have a symptomatic individual who was a close contact and returns to school during the period of time that they should be involved in test and stay, then they would go ahead and do that. And we refer you back up to the test and stay protocol so that that individual does continue to be treated like a close contact after symptom resolution. And I realize that, might need some additional time to kind of reflect on and think about to make sure you have the systems ready to, kind of identify who those individuals might be and keep track of individuals. But we knew that question would come up, so we wanted to make sure that we really highlighted that important note. And then, the alternative protocol for individuals who do not receive a COVID test. Keep in mind that it's at least 10 days from symptom onset, and you can return to school on day 11 as long as, again, there's an improvement in symptoms and a fever has not persisted. So, I hope that's helpful when we think about a lot of these, different scenarios around if you're exposed or if you have symptoms. And again, building on some new information, but also keeping and confirming a lot of what we knew from the past. So again, I hope that's helpful to you. Let's look at the what our protocols are for individuals who participate in our testing protocols, particularly our routine COVID safety checks, our routine COVID pool testing. Remember, it's the same thing. We're calling it routine COVID pooling to you. With parents, we're recommending that you call it routine COVID safety check, so it's a little clearer about exactly what it is. And really kind of two scenarios here. This is, again, pretty basic, and I hope pretty familiar to you. If the group pool test is negative, then everyone just remains in school. Everyone's presumed negative, participated in that pool, and they should remain in school. If there is a positive result to the pool, then the individual is one way or another going to need to be retested using a rapid antigen test. And I'm going to say a little bit more when I go back to my slides about that difference between if you're doing the follow-up testing in the schools, or if you're choosing one of our options that allow for lab-based follow-up testing. But either way, either in the lab or in the school, the individual is going to have that follow-up testing with either a rapid antigen test or by next now. And I'm sorry, either a rapid antigen test or a PCR test. And as long as they're asymptomatic, if they're not the pool, the person who's identified as positive, then they would remain in school. Individuals in the group should wear masks until the positive individual is identified. And if you are symptomatic, I think this just goes without saying, you should always stay home. So even if you're identified as negative, if you are symptomatic, we want to make sure that you stay home. So that's really, a quick overview of the document that we released. I hope that maybe my narration helps you with knowing where to go for the information that you need, thinking about, the way that we've labeled them by alphabet. We do have some additional information at the end that I won't go over right now, trying to address some of the key questions that you've already asked us. So I'd ask you to take a minute to make sure that you're familiar with these questions. They might answer some of the questions that you have on your mind even right now. And again, we will have more information, more FAQs on the way soon. So just bear with us as we continue to make sure we get solid answers for you. And we look forward to making sure that you get what you need in order to be successful. So as I transition back over, just want to sort of summarize again that the protocols are in place to give you the information that you need to start the school year off right. We can't wait to get our students back in person. We've given you the it's also important to go back and look at those recommendations around mask wearing, and keep in mind that, we really believe that students can be safe in person, learning together the way that we know is good for kids. And we just really appreciate you working out the implementation of these protocols so that we can keep as many students and staff in school as safely as possible and as consistently as possible. So I'll turn back over now to the slides and go through any other information that would be useful to you as we continue to think about our testing program. And I hope you don't mind, I'm just going to stay in non-presentation mode because we don't have a ton of slides in this section. We were really trying to make sure we save time for your questions today. So just a few more details about our testing program for the upcoming school year. And just starting with a reminder about our the program and that difference that I was telling you about between whether we're going to have follow-up testing in the school or lab-based follow-up testing. So follow-up testing in the school is, again, this is what we did last year. So if you were involved in our program last year, this is hopefully familiar to you. What it involves, in case you're new to our statewide program, is that this requires samples to be collected at the school. So if there's a positive pool, we ask that the school then follow up with each of the individuals who were in the positive pool. We're providing Binex now free of charge to you. Some districts last year asked if they could take care of it using PCR testing separately. And we are okay with either one of those. It can be rapid antigen using Binex Now or individual PCR test, but just keep in mind that either one is acceptable. But what's new this year, and that I'm going to go into in a little bit more detail, is about the lab-based follow-up testing, because we've had a lot of questions about it. And there are just two different ways that CIC, our partner in this work, will be able to do lab-based follow-up testing. So that's really what I want to hone in on today and show you this difference in the way that we have follow-up testing. So again, this just reiterates what I was just talking about follow-up testing at the school. Keep in mind, again, this is because we now have the option of saliva-based testing. I'm just pointing out that kind of how we can kind of compare apples to apples, how these all work. And so if we are collecting in the school, we're using a nasal-based swab. As the name implies, collecting in the school means that we are gathering these samples in the school. We're observing the individual while the self-collection occurs. If we're using a PCR test, it's processed at the Broad, and that pool, the pool is always processed at the Broad, and we have 10 samples in each pool. Going on though, and again, this is what I really want to make sure that we are all really aware of as we go forward, because this is what's new and I think helpful for this year. Really excited that we can bring this to you. But there are kind of two ways that we can do lab-based follow-up testing. And the first is what we call a double sample collection. So, and if you could imagine, let's just say students are conducting the swab in the school, they're going to do it twice. So last year we would have done one swab, right? This year we're going to have the student do it twice. One sample goes into the pool. The second sample is kept separate from the pool, and both are shipped off to the lab. So again, collected at the school, processed by Broad. But then what happens is if there is an individual pool, if there's a pool that shows a positive result, then we go back and look at the individuals who were within that pool, pull those samples in and run them through a PCR test to figure out who that positive individual might be, or individuals. And again, that is going to cut down on the amount of in-school testing that's necessary. And so just important to know though, that it would require 2 samples. So swabbing twice instead of once, which is different. It would take a little bit more time, but all in all, sample collection is really quick. And so doing it twice really shouldn't be, I don't think, a real burden. But then let's talk about single sample collection. So this is new for this year as well. With single sample collection, again, follow-up happens in the lab, but we're using a saliva-based sample. So the student or individual staff member, student collects the saliva at home, brings it into school. This is processed by Veritas Genetics, and there are 5 samples in each pool. And what happens is because they can separate the saliva, they're able to run part of it in a pooled methodology and then saving back some of the sample in case there's a positive from within that pool. And then they can use that to determine who the positive individual or individuals might be without having to go back and conduct a second round of testing. So again, important to be thinking about, where do you want, if you're choosing the lab-based follow-up testing, then you also need to think about, do I want to use a saliva-based single sample collection or a nasal-based double sample collection? Either is fine. We welcome you to choose either one, but it's important just to make sure that you're thinking about which one is going to be right for you and your school community. So I hope that helps to explain. We know we had a lot of questions about, what's going on with this in-lab follow-up? So just wanted to explain more of those details to you today. Let's talk about some next steps. First of all, if you haven't already, please go online and start the process to apply, which is through our authorized school application and completing the statement of assurances. And like we said last week, if you apply by August 20th, you're receiving priority status for services on as close to August 30th as at all possible. We're working really diligently to make sure we can deliver on that. So, if you're in the process, get it done by Friday so that you're able to kind of be very much first in line for those services starting on August 30th. If you are starting before August 30th, just please note that so that we can really work to the best of our ability to get those services going for you. We know that some school districts are starting very soon, some large districts even as soon as next week. And if you have any trouble uploading any of the documentation, please just send an email. We're ready to kind of troubleshoot with you and make sure that you get the information that you need. And then this very afternoon, CIC is hosting a webinar. Hopefully you got the information. That's why we're asking you to register for these webinars and give us your email address so that we can push information out to those of you who are particularly interested in these topics with things like the CIC webinars. They had one last week, they're having one today. We just really encourage you to participate to hear more directly from them about a lot of these important next steps. And then speaking of next steps, keep in mind that we've got our information ready to for parents, and we've got our template letters for you to be able to use, and they are translated into multiple languages. So like I showed you last week, download that letter, and it can be customized. In fact, it has to be customized. You at least have to put in some information, including the link to how the parents can consent to testing. Keep in mind that we are requiring parents to consent again this year. The testing program is different than it was last year. I always think we ask parents to consent to having their children photographed in school every year. Then it's equally important, or even maybe more important, that they have to consent every year that we're doing a testing program last year and this year, that they have to consent again. We want to make sure that it's very much an informed process for parents, that they know what we are planning to do with and for their children. Just a quick reminder about the vaccine clinics that we have available. We've got the link for you to be able to request a clinic. I showed that earlier to you in the protocols document. Here it is again. Really excited about the uptake and interest in setting up vaccine clinics. Keep it going. I know our partners at the Executive Office of Health and Human Services and DPH are just so very motivated to see as many vaccine clinics as we can across the state as early in the school year as possible, because we just know it's so key to really having safe schools for everyone in our school communities. We've got the consent form here for you as well, particularly the form that you'll need for people who can't sign as their own guardian, those who are under 18 in particular. Again, just a quick reminder about our testing webpage that we have available for you that includes the memo. We'll be putting up our slides and recording. The recording sometimes takes a few days just because it has to go through a process to be able to be posted, but we're getting there, and it should be available soon. Everything that you need in the way of an application process, just like I mentioned, sample letter, and all the information about Binax Now is in one location this year. Last year, if you recall, there was one location for Binax Now, another location for pool testing at the time. Now we've combined it all into one so that you can get all the information that you need. And as always, don't hesitate to reach out to our COVID-19 testing email address for any questions that you might have. So that's actually it for me today. I was hoping to stay at about 30 minutes, and I'm at 32. So for me, who often enjoys the sound of my own voice, that's not bad. I'm going to stop my share and turn it over to Q&A so that we make sure that we get the information that you need in a timely fashion today. So Lauren, let's find out what people need to know.
Sure, Russell. Great job. So just a couple housekeeping pieces. We will be sending out these slides, and the link to the protocols is online, which I will put in the chat again. Any questions that we don't answer in this quick half hour right now, we are going to be issuing future frequently asked questions that will be sent in the Commissioner's Weekly Update, both specific to the protocols that we just released and to our COVID-19 testing program. So please look out for the frequently asked questions, which we will have shortly. One big question is, will DESE be releasing flowcharts or a family-friendly user guide against these protocols? And the answer to that is yes. We are in process of creating that, and we hopefully will have something released soon. A question, Russell, about who developed these protocols. If you could talk through that.
So important to note that this was done in close conjunction with our state epidemiologist, with our state medical director at DPH and their teams, with our colleagues at the Executive Office of Health and Human Services. This was very much a group effort, coming together with the best kind of scientific and medical knowledge, along with DESE's knowledge of schools, how they work, working with families. And so this is very deliberately labeled as DESE and DPH guidance, because it is a joint effort with really the combined knowledge of both organizations coming together for this.
Great. Could you, Russell, it might be worth putting up the protocol document again, but there are some questions about the list of symptoms, and to review again what the bolded symptoms mean, and then what is considered mild symptoms.
Right. Try not to make people seasick, but we're from the Bay State, so we can deal with this. walk back and forth as we get to the symptoms list. All right. Lauren, what do you think people more specifically need to know about this? I'm glad to go inside a little further.
Yeah, could you just review the piece about the bolded symptoms?
Absolutely. So we think about these as the standalone symptoms. These are the symptoms that when we see these symptoms, if they occur, if a school health professional and nurse particularly sees these symptoms being exhibited by an individual, a student, a staff member, we want to make sure that they count as symptomatic immediately. And I think that, the cough, again, I kind of put in my green highlights. It's sort of close to being in the same category. It's just, it wouldn't be if we know it's from another cause, like a chronic cough. So again, an individual presents with a new loss of taste or smell, that individual immediately needs to be treated as symptomatic. We would ask you to go to that part of the protocols and follow through as appropriate. An individual comes into the nurse's office, again, just using a pretty common scenario with a sore throat. We wouldn't treat that as being a symptomatic individual unless it's in combination with other symptoms. So that individual who comes in with sore throat and a cough, and the cough isn't from another known cause, or sore throat and muscle aches, that's when we say, yes, that person counts as symptomatic and we need to take the appropriate steps that are necessary. So, I think that differentiation really helps. And it's important to note that last year we had fewer of the symptoms that were identified as only being when in combination with other symptoms. And so just keep in mind that this list has sort of, it's evolved just a bit. And so it's important to keep in mind what has changed here.
Great, thanks. So now some questions about transportation. So who does, do we still need to have assigned seating on the bus? Can you go over who's identified as a close contact, if at all?
I think we really learned a lot last year about what works best in your school community. And so keep in mind that, right now, what we define in this document is that individuals who are on a bus would not be identified as close contacts because, we know that they have to be masked according to federal requirements. So that's just a requirement across the whole country that individuals on school buses or any form of public transportation have to be masked. We want to make sure that those windows are open, right? So there's a lot of air transfer on the bus as it's moving. And as such, individuals who are on our school buses would not count as close contacts and don't need to follow the steps they wouldn't be exempt from testing and quarantining. So we haven't changed the definition of close contact, but individuals who are identified as close contacts from being on a bus don't have to go through the testing and quarantining response protocols. Lauren, does that get it where the question was headed?
That does, thanks. And when we say individuals, we are talking about staff and students. So bus monitors and bus drivers should be masked and following this protocol.
Absolutely.
Great. Okay, so our next questions are about any information about masking and the lunch protocols. So just wondering when students need to be wearing masks and what distance needs to happen between them.
Yeah, so, we think that it would be, where possible, if possible, to maintain that 3 feet of distance when students are taking their mask down to eat is advisable, but not required. And so we, want to be very clear that we don't have distancing requirements. But again, last year, we learned a lot about what was effective, what worked in your context. And so we would encourage you that, if you're able to maintain that 3 feet of distance or have the students eat outside, that is definitely a good practice. But at the same time, we know that students need to eat when they're in school, and so just encouraging you to make it, as safe, eating environment as you can. Lauren, I don't know if you want to add anything more there based on the, this is something that we will address in our forthcoming FAQ, and so this is the direction that we're heading in with our response. So I just want to see if there's anything else that you'd like to add.
Nope, I think that's great, Russell. More to come in a forthcoming FAQ. Some questions about test and stay, in particular to go over the duration of the test and stay period in that protocol, and to talk about what should happen on non-school days, particularly the weekend or holidays.
Great. What we want to see happen is that we're talking about a duration of 7 days from the date of exposure. So it's possible that some days have already gone by. You know, by the time that we find out that a person tested positive in the classroom and there was exposure, maybe that person was symptomatic, already went home. The next day we find out, so 1 day has already passed. So we're looking at 7 days total from the date of exposure that we're conducting the test and stay program. So we're looking to be able to, to count up to the day 7 from the date of exposure. And we're just asking that you, establish a system where you can conduct that rapid antigen test on a daily basis, looking for those results, hopefully seeing a negative result, and being able to keep our students in school. We know, though, that very often that 7-day period is going to fall over a weekend or a long weekend. And so let's just imagine that day 7 happens on Sunday and students come back to school on Monday. We still want to have those students tested on Monday, right? Just to confirm. So it's not like we run out the clock and get to day 7 and say, oh, well, no, we get to day 7 if it falls on a weekend or a holiday, and still have the students or the individuals who are participating in test and stay have that rapid antigen test, that Buy Next Now test, when they come back into school on whatever day follows day 7. Now, it gets a little different when we get into like week-long vacations. Fortunately, that's not going to happen right at the beginning of the school year. So let's just stay focused on 2-day weekends, 3-day weekends. That's what we're going to need to get the hang of as we start the program. And then when we look at individuals what they're doing on the weekends, we want to make sure that our students are quarantining and recommending that to parents to say, your child is a close contact. We want them to be able to come to school, but we also, want to make sure that on the weekends, if you're not getting tested and we don't know what's happening, then our recommendation is to quarantine. Lauren, anything else that we should add about that?
Just to note that this protocol applies to unvaccinated close contacts, and the individuals we're referencing are for both students and staff. A few questions about CIC's ability to be able to provide the testing capacity full time to account for weekends, and we are working on that, and so we will be providing more information, but to contact CIC directly about the availability of testing observers or administrators over the weekends for individuals that are participating in sports, close contacts that are participating in sports.
And we'll have more information about that, again, that sports piece in our upcoming FAQ. So, and if we need to do another webinar after that, we certainly can. But keep in mind that we'll have more information that's not in this document, but would be forthcoming about extracurriculars that occur on the weekend. So we'll make sure we draw your attention to that when we release that FAQ.
Great. Some questions about the ability to provide remote or virtual learning this year.
Yeah, so when an individual has to be out of school, just like, in the past when students would have to be out for chickenpox or exposure, they would be counted as absent. And so right now, and that's why we really want to make sure that we get test and stay up and running in as many schools as possible, because we don't want students out of school if we can avoid it, if we can maintain healthy, safe learning environments like we believe test and stay will allow us to. We want to keep our kids in school, but if they do need to quarantine or if they're symptomatic, those days would count as days of absence, just like you do when students are absent and maybe still able to participate in learning. You can send work home, you can keep learning going, you can keep learning alive, but the time would not count towards time on learning. And so, I know we've had a lot of questions about that, Lauren. I really appreciate that you brought it up here today. And just really, I think that's why I so appreciate the interest and enthusiasm for Test and Stay, because we really want to keep our students in school as in as healthy and safe way as we possibly can.
Great. A question about singing in band and other high respiratory activities, and whether there are any restrictions for students engaging in those activities indoors.
Yeah, this time there are not restrictions. We want to make sure that we provide students with that full complement of learning experiences that we know that they benefit from. However, you did learn a lot about this last year. And, it seems like it would be a good idea, right, to have students spaced when they're singing or when they're playing instruments that involve a higher level of respiration. Those band instruments, can you tell that I was not a band kid? And so, the horns, the wind instruments that require more respiration, having that distance is a good idea. Being outside is a good idea. Using the adjustments that you're able to make to the horns and the woodwinds last year is also a good idea. You learned a lot about this. And if those kind of additional safety mitigation strategies made sense last year, we'd recommend that you apply them this year, but it doesn't in no way means that you don't do chorus and band or those types of activities. We think that they're important, but we want to make sure that we just, again, build on what we knew worked well towards the end of last year when we were doing more of this, and just keeping those same strategies in place for this year.
Great. And some questions about whether or not vaccinated individuals should be participating in the COVID pool testing.
It's important to note that they can participate. They may participate. Jeremiah, why don't you take this one, since I've done a lot of the talking today?
Yeah, no, that's exactly right, Russell. So the recommendation is strongly that people who are unvaccinated should participate in that weekly testing. But certainly the Dr. Madoff, who I know has joined for some of our school testing webinars, who's the director of the Bureau of Infectious Diseases for the state, always says more testing is better. And so I don't want to, create anxiety, but certainly if people who are vaccinated want to participate, they certainly can. And in general, more testing is better.
Great. Just reviewing our list, Russell. I think it's a good reminder for people that the Rapid Response Help Center is always available to individuals. And so very specific questions about your contact should be filtered to Anne Marie and that team. And I will again put the information in the chat so that people have that number available. And one question, Russell, that's coming up that we're going to be issuing and discussing in a forthcoming FAQ is whether or not the Test and Stay program can apply to close contacts that are identified outside of school, so non-school-based close contacts. And this question came in a few times, so we will be addressing it in a forthcoming FAQ. And a question about if schools need to report cases to DESE this year, and the answer to that is no. Districts do not need to report positive cases to the Rapid Response Help Center. Russell, I think that is the extent of any new or unique questions at this time.
Lauren, I know that we've had questions that have come in about the medical waiting rooms that we used last year. And so maybe just touching on that and using this as an opportunity to point out that DPH, and really this was, again, a joint effort that between DPH and DESE, but really, DPH, I don't want to take credit for it because they did the heavy lifting on the additional information for school health professionals document. So it just, make sure that if you haven't already made, ensure that your school health professionals, your nurses have seen that document. So important. Just came out last week. And I know that DPH has really done a great job of getting that information out through their networks, but there's some good information in it for everyone, not just school health professionals. But a really key thing is about those medical waiting rooms. And so again, if it's possible to have a medical waiting room, we recommend that you do that, but we know that space is at a premium in our schools. And so it's important to note that it's not required to have a medical waiting room. And that document really clearly lays out, if you can't have a medical waiting room, what do you need to do instead? And to make sure that, wherever you are, if you have an individual who is symptomatic or who has tested positive in your school, that you need to have a place where they can be 6 feet apart, where they can be masked. Our document lays out all the requirements, kind of going off the top of my head right now, but that additional information for school health professionals document that, again, we have the link to in our documents and that we sent out as well in this week's Commissioner's Weekly Update. Please take a look at that, particularly as you are, we know, gearing up for the new school year and wanting to make sure, thanks, Lauren, that's awesome, that we want to make sure that kind of as you're thinking about your space configurations, what you need to do to just be ready for anyone who might be symptomatic or test positive in your schools. Anything else from our team?
I think that covers it. I recommend folks continually check our COVID-19 testing program website for updates to that site. We will be posting additional FAQs and more information there. So I will put that link in the chat.
Great. Well, thanks everyone. We hope you found this helpful, and we look forward to just hearing about your start to the new school year. Thank you again for all that you are doing to welcome our students and families back. We hope you have a great and successful start to the new school year. We can't wait to hear how it goes. Please keep us informed, keep your questions coming. We want to help you just launch the new school year with confidence and with safety in mind. So thanks again, everyone. Have a great rest of the week. Be well.